These vaccine side effects could mean you had COVID before, study says. When someone receives their COVID-19 vaccine, they are observed at the vaccination site for side effects. Even if nothing appears soon, they are asked to monitor their condition at home and contact the vaccinator or their doctor when needed. Many people across the globe have experienced side effects, such as arm swelling and fever. However, experts say these are normal events. The events indicate that the vaccine is working and these should go away after a day or two. But if you already had COVID-19 before, what kind of side effects would you experience after getting the jab? A new study showed that certain vaccine-related side effects were more common in people who previously had COVID than those who haven't. Researchers in the UK analyzed the records of 947 people who were monitored for side effects after vaccination. Of that, 265 had a history of SARS-CoV-2 infection, and 11% of them complained of long COVID experience. They applied two-way ANCOVA and logistic regression to determine the most common side effect which could be associated with previous COVID-19. Among the four most common side effects detected, the one that stood out was lymphadenopathy or swollen lymph nodes. The other three were fever, fatigue, and muscle and joint pain. Together, these side effects were reported by 56% of those who had COVID-19, compared to the 47% of those who haven't had the disease. According to BestLife, 4% of those who had COVID reported swollen lymph nodes, compared to less than 1% of those who had no history. Around 8% of those who had COVID reported fever, while only 2% in those without history. About 29% of those who had COVID reported fatigue, while only 20% in those without history. Around 30% of those who had COVID reported muscle pain, but only 15% in those without history reported the same thing. About 17% of those with a COVID history reported joint pain, compared to only 7% in those who had no history. Researchers concluded that prior COVID-19 is linked to an increased risk of self-reported vaccine-related side effects, specifically the Pfizer vaccine as noted in the study. While the cause and effect were not unveiled, the findings could be used to support education regarding vaccine-related adverse events. Some experts ask if people who had COVID-19 still need a second dose. For the US CDC, completing the full vaccine series is recommended unless the healthcare provider of the patient says otherwise. The findings were uploaded in medRxiv.